This aesthetic space is a crazy cool combination of medicine and art. It's my honor to be able to step into this space and cultivate relationships with my patients and help them to embrace their flaws and the things that make them unique and asymmetrical and perfectly uniquely them. Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. Time marches on, and as we age, we are losing collagen at a rate of 1 to 2% per year. Collagen is the single most abundant protein in our bodies, and it's necessary for healthy bones, radiant skin, resilient muscles, and well-functioning joints. To combat the loss of collagen, I've been using liquid BioCell oral collagen from Modere. I love this liquid collagen so much that I decided to partner with Modere to offer you $10 off your first order. Use the link in the show notes to redeem your discount today. Hey there, and welcome back to another episode of The PA is In. Today is all about my relatively new to me clinical specialty. So if you are new around here, or just in case you didn't know, I work in private plastic surgery, outpatient in the office, primarily in the aesthetics space. So I started out doing a mix of plastic surgery, like post-operative management of cosmetic and reconstructive patients for my 3 surgeons, and aesthetics. So I was doing a mix of plastic surgery and aesthetics. But in the last year and a half, I have transitioned into primarily aesthetics. The majority of my day practicing clinically is neuromodulator and filler patients, everything from consulting with new patients and creating a comprehensive treatment plan to treating those patients with Botox, hyaluronic acid fillers, biostimulant injectables, and more. So in my experience working in a space that is cash pay, cosmetic and aesthetic, read completely elective procedures, is a night and day difference between the insurance-based, medically necessary surgery that I have done previously in my career as a PA. I still identify as a surgery PA. Deep down, I feel like surgery is something that I love. And the procedural aspect of what I do in aesthetics, I think, was a big draw for me, switching from general surgery and urologic surgery into this aesthetics and injectable space. So here's what you can expect to hear on this episode of The PA is In. I'm sharing 3 surprising things that I love about working in aesthetics. I'm coming up on my 3-year anniversary of being in this aesthetics and plastic surgery space, and I wanted to share 3 things that sort of took me by surprise, but that I like and enjoy and embrace about existing in this aesthetics space. First up, my relationship with my patients. Being able to do aesthetic injections and have this deep relationship with my patients is a little bit like therapy. So hear me out here. This is something that I noticed very early on in treating patients of an aesthetic nature. It's sort of like, that relationship that you have with your hairdresser where you sit down and you spend this time with them and you tell them things that you wouldn't necessarily tell even some of your closest friends. This is the type of relationship that I have the honor and the ability to cultivate with my patients. I see many of my patients on a quarterly basis for neuromodulator injections every 3 months. So this is actually going to surprise you based on my clinical history, but when I was in high school, all the way from shadowing and deciding to become a PA through my last year of PA school when I was on rotations, I thought I wanted to go into primary care, which is so funny looking back. I can hardly believe it myself, given my 10 plus year career in surgery. I am a surgery PA through and through. And as I mentioned earlier, I still self-identify as someone who is a surgery provider. I'm a provider who loves the OR. I love procedures. I enjoy being the one holding the needle or the scalpel or the suture in my hand. I am the person who would love nothing more than to clamp a renal artery for a complicated partial nephrectomy today at this very moment. If someone offered me that opportunity, I am the one who said, I thought I wanted to go into primary care. So let me explain the why and how this relates back to that relationship that I have the ability to cultivate with my patients now in this aesthetics space. When I was in high school, I did some job shadowing when I was trying to figure out what I wanted to be when I grow up. Still haven't grown up yet, but this is when I was trying to figure out what career path I wanted to pursue. So I ended up shadowing a couple of PAs, and one of them was in a primary care office. In fact, my primary care office where I used to seek care as a young adult and into my early adulthood, I shadowed this primary care PA. Her name is Sarah. Hi, Sarah, if you're listening. I got to spend a few days with Sarah, seeing her patients, seeing the type of medicine that she was doing, the degree of charting, all of the things that she was doing. Even back then, I remember noting the wide range of ages and the variety of patient complaints that were on Sarah's schedule that day as a primary care provider. Also remember the charting burden and how much she had to know about so many different aspects of medicine. But my favorite part about primary care was the longevity of her relationships with patients. Sarah got to see these patients over time. She saw them through childhood and into adulthood. In fact, she saw me through childhood and into adulthood. She saw babies and moms. She treated entire families. Sarah was able to help navigate the health of geriatric patients as they approached the last years of their life. And she treated the young kiddos of those grandparents as they were in their early years of life on this earth. And she knew them. She truly knew these patients. She had deep conversations with them, and she got to know them over time. So that shadowing experience led me to think that primary care was the place for me. In fact, I applied for primary care scholarships, and I thought that primary care was the thing that I wanted to do. Fast forward from that high school shadowing experience, which shaped my life and my career and helped me decide to become a PA, to when I was out on rotation my second year of graduate school as a part of a PA program. I stepped into the operating room and the rest was history. I loved the OR. I wanted to die in that room. I was like, wow, it is cold in here. Also, what a cool and crazy privilege that we get to do this really intimate thing and take care of this patient in such a unique and cool way. I adored the fact that we got to fix something that was broken to help solve an acute problem, to excise a patient's cancer, or in short order, help that patient to feel better, to relieve their pain, to fix that problem, to be able to, right at that point of care, make them feel better. In both general surgery and my position in urology surgery, I didn't get the chance to cultivate that long-term relationship that I saw in primary care when I was shadowing. I was doing acute care and inpatient rounds. I was solving problems that were acute in nature. And even the patients that I saw in the office, when I was in general surgery, I did a mix of inpatient and outpatient. So I did see people in the office, but it was Mr. Smith came in with a hernia. He had pain. We identified his problem. We planned to fix it. We scheduled him for short-term follow-up. Of course, we saw him in post-op, but then unless Mr. Smith needed a colonoscopy or got a hernia on the other side, I didn't see him again. I didn't have that long-term relationship over time with a lot of my surgery patients. I will say in general surgery, we did do some surgical oncology cases. So cancer patients we would follow on a more long-term basis, but it was a relatively small sampling of the amount of patients that we were seeing. But those patients, I love to get to know over time. I love to see them the following year because I would know them and know their families and remember them. And that little slice of general surgery patients, I really enjoyed being able to see over time. Otherwise, especially in general surgery, but also in my position in urology, where I was that acute person who was seeing them, admitting them, operating on them, discharging them, it was a relatively small window of time that I got to cultivate that relationship with patients. With aesthetics, I have the pleasure of seeing my patients every 3 months often. These ongoing relationships with my patients are one of my favorite things about practicing medicine in this cosmetics and aesthetics space. People also come in for treatment before big occasions. So their weddings, their kids' weddings, graduations, travel, trips. And I get to hear what they're looking forward to and why they want to look their best for these events. And then when I see them next, I get to find out how it went and how they felt and how what I did to help them to feel more confident for those upcoming endeavors. People share things with their injectors just like they do with their hairstylist and their therapist. We often joke that it's part therapy and part treatment when we're injecting, particularly if we have this longer visit, because as we are doing this visit, we have this chance to talk and to catch up. And during those visits, my patients and I talk about everything from societal definitions of beauty and confidence and self-esteem and self-worth and what it feels like to raise kids in this world and how we can influence the way that they see themselves and feel about themselves and their bodies and everything in between. It is truly an honor. It is my honor every time a patient trusts me with their procedure, their safety, and the aesthetics of their face. We're going to get in a little bit later into some of the details about anatomy and safety and some of the challenges and things that I enjoy about being in this aesthetics space. But just the fact that patients have this choice of who they're going to trust their face to, and that they come to me and that I get to know them over time and what motivates them and what scares them and what bothers them and what they love about themselves when they look in the mirror. Truly, truly, it is an honor to be at their bedside for that experience and to be able to treat them in that way. Since I started working in aesthetics and plastic surgery, I've taken a hard look at my skincare routine. Our product choices make a big difference in how we look, and that influences how we feel. Confidence can't be bottled, but if it could be, you'd find that confidence in Modere's Cell-Proof skincare line. My favorite products are the serum, double cleanser, and the infusion mask. The infusion mask feels amazing. I use it 2 times a week, and it's a great skin pick-me-up that's safe, quick, and effective. Seriously, my skin has never looked or felt better. For $10 off your first order of the Modere Cell-Proof skincare products, use the link in the show notes. Number 2 on my list of 3 surprising things that I love about working in aesthetics is the community of injectors. Honestly, with as competitive as it is to break into the aesthetics industry, it definitely surprised me how collaborative and encouraging the community of injectors is. Part of this, I think, a big part of this is the amount of injectors who have an online presence. Now, I don't know that there are a whole lot of colorectal surgery people cultivating an online following and sharing their work. It's just a very different space. But the fact that so many injectors have an online presence opens a door for me to be able to follow and connect with other people in this aesthetic space. So, despite that relative competition, the community in aesthetics is powerful. It is interesting and inspiring to see the collaboration that exists within different providers in this space. Now, that is true for PAs and NPs and MDs and DOs, and there are a lot of states where nurses are injecting. So there is a wide degree of credentials that come under this umbrella of injectors and of people who are injecting in this aesthetics space. So there is this great amount of sort of long distance unofficial mentorship that happens, whether it's in-person support of other people in your practice or in your community or area, or training with other injectors. We have trainers that come into our office. This injectable space is incredibly supportive. So a great example of that is my friend MARYELLEN Bishop. So MARYELLEN was a guest way back on episode 107. She lives states away from me. I've never met her in person. However, she is one of the best PAs in this aesthetics and injectable space in the entire country. We found each other through the PA Moms group, and I am continually amazed by her work. She is a great follow on social media. She is also a trainer for one of the largest companies in the aesthetic space. And it's so cool because with social media, with all of the downsides and all of the potential opportunities for comparison and imposter syndrome and feeling like, wow, there's so many other people existing in this space. The great thing about having an online presence in this day and age is that MARYELLEN is one message away. That I get to follow her for encouragement and inspiration, that I can message her for advice and the question, what would you do in this situation? Or have you tried this product? Or do you have specific advice on how to do this thing? Or what would you do in this situation? And that in social media, that there is this access to people that is a unique gift, and that it can be leveraged to improve your ability to take care of patients, that there are people out there showing you what they're doing and how they're doing it, and that you get to take those ideas and say, does that seem safe? Does that seem effective? Does that seem like something that I want to try with my patients? And then that collaboration of the online community is such a unique aspect of aesthetics. Speaking of trainings, aesthetics is a space where trainings are readily available. It is like something I've never seen in sort of traditional medicine and other specialties, whether you're talking about in person conferences or having a trainer from one of the major companies come into your office, or an independent trainer, or following other injectors online, or subscribing to Patreon for people who are big in this space of educating on aesthetics and doing it safely and effectively and knowing the anatomy and understanding the pathophysiology and the why of the aging face and what happens when faces age and what we can do to help mitigate those outward sort of manifestations of deep structural changes that are happening as the consistency and the makeup and the layers of our faces change. It is so incredibly cool. Training is abound in this aesthetic space, and I love that because I'm always trying to learn new things, and that should be true regardless of what industry you're working in, regardless of what specialty you find yourself in. When I first stepped into this aesthetic space, I felt a little bit on the outside of this community. But after leaning into and cultivating some relationships with others in this space, it feels really great to have other providers, both near and far, to bounce ideas off and collaborate and also commiserate with, because it feels important to be seen and heard and say, are you struggling with this? Or what would you do in this situation? And to have people who get it, who are also in this same space, to be able to give you feedback and to offer support when you are facing a challenging situation or unsure of what to do about something. Third on my list of the 3 things that I absolutely adore about working in aesthetics is the challenge and the art aspect and the creativity that comes along with being in the aesthetic space. It is a real technical challenge to inject someone safely. And there is also this aspect of art where the artistic nature of helping to rebalance someone's face and highlight the features that they love and minimize things that bother them, that comes into this like cosmetic, aesthetic, artistic aspect of what I do. When I first started, I was honestly coming from a position of overconfidence from my background in surgical training and my confidence in being able to understand anatomy and both form and function of the human face. So, although my surgical background prepared me well for the technical aspect of using my hands, of performing the procedures, of the actual injecting, at that time when I first started in aesthetics, I underestimated the importance of things like safety and variance in anatomy and keeping up with best practices in this aesthetic space. And probably most significantly, the challenge that comes along with being an artist that evaluates each person's unique anatomy, their features, the way that those features play together in someone's face, and how to improve and tweak and change the appearance of someone's face from an aesthetic nature. So, not only is everyone's anatomy unique, right? So, none of us look exactly the same. None of our superficial anatomy is the same. Our deep anatomy is not the same, but their aesthetic treatment goals and budgets are different. So I find the hardest and most challenging part of what I do is being able to sit down with a patient and do a full facial assessment and form a comprehensive treatment plan that is going to work for them and help them meet their aesthetic goals.
A really common misconception about Botox and filler treatments is that if you do them, you will look fake and overfilled and artificial. And it will become very obvious to everyone in your life that you have had Botox or fillers or lasers or whatever treatment you're getting. There is absolutely a way to utilize these tools to improve balance in the face, to highlight positive features, to minimize things that bother people in a way that is natural and cohesive and not obvious. Well placed filler makes people look better, brighter, younger, but it doesn't make them necessarily look done or overdone. I adore one of my very favorite things about being in this aesthetic space is being able to help boost my patients' confidence by balancing their face. I also take pride in being able to take care of patients in a way that is safe and reasonable, subtle, and effective. Oftentimes, this leads me to saying no to patients' requests, and alongside that no, educating them about their anatomy and why what they're requesting is contraindicated given their specific situation or past surgical history or things that they've tried and done in the past or what products they've had previously. The thing about being in aesthetics and the thing about social media is there is a ton of misinformation floating around on the internet about aesthetics treatments. And people come in asking for tons of things that are, maybe off label or, just sort of starting, that people are just trying. And you have to sort of take that information and say, well, what does the anatomy say? How does this work? Does it feel safe? Are there deep structures we need to worry about? Are there things that are concerning me that are deep in the face or that maybe people aren't evaluating? Because just because it exists on the internet doesn't necessarily mean that it's evidence-based, that it's true, that it's proven, that it's been, safe and rigorously tested. It is both my pleasure and a little bit of a challenge to educate patients on things like on and off label uses of the medications in our tool belt, their safety profile, their specific indications, and their potential complications. Injectables are just like any other procedure, and they exist in this weird gray space where they're cosmetic and elective, but they are also a specific treatment and procedure with a medication. Just like any other medication or treatment or surgery, we review informed consent with our patients. We share the risks, the benefits, and the alternatives, which always includes not treatment because almost all of what we're doing is elective. So being able to say, here is the potential upside, here are the risks, here are the potential benefits, and review that with the patient so they understand that there are very real consequences and potential risks to what we're doing is a super important thing in this space that feels very cosmetic, but is also an overlap to the medicine and to that informed consent, to making sure patients really understand what we're doing, why we're doing it, what results we're expecting, and what could potentially go wrong when we do those. So this space is very interesting because everything is elective. So weighing those pros and cons of treatments and expected results and investments all are sort of under this cloud of it's elective. So if someone comes in and says, look at me, what do I need? The answer to that question is always, you need nothing. Nothing of what we're doing is required. However, what bothers you? What do you like? When you look in the mirror, what do you really enjoy about your face? And how can we highlight those features? How can we create balance and improvement in your profile and highlighting the things that you really enjoy and combating volume loss in a way that is subtle and balancing and feels good and reasonable to you and also works with your budget? So the hardest part is this unique full facial assessment, sharing with patients what would be best for them given their age and skin and anatomy and favorite and least favorite features. I also always try to share with patients that the two halves of their face are sisters and not twins. I heard this analogy once in a training and it really has stuck with me. So we can improve and minimize some asymmetries in the face, but we're never going to get it to be an exact match. And I tell patients that's because we come together embryologically as two halves, not as a 3D printer top down. And I love to be able to educate patients about that because no one is symmetrical with or without treatments. No one is exactly symmetrical. In fact, if we actually look at pictures of people and they are symmetrical, it looks strange. Our brain will notice the lack of asymmetries. If someone is truly a mirror image, left side, right side, they will say it looks weird. It doesn't look natural to be completely symmetrical, which is great because that's not the goal. The goal is to, minimize some of those asymmetries, but not to take them away completely. That being said, bringing safety and ethical treatments to my patients and being able to review a true and complete informed consent, to have that discussion with them, to make sure they understand what we're doing, why we're doing it, what the expected results are, and educating patients on all these different aspects of their treatment and care is something that I love about working in aesthetics. It's definitely a unique space. It includes a strange balance between procedures, medicine, and this aspect of sales. In my past, my informed consents or procedures that I was educating people on were for life-saving, emergent, urgent, medically necessary procedures, like a stent placement for an obstructing stone in a patient with bacteremia, or a lap chole for acute cholecystitis in someone who is ill and hospitalized. Aesthetic procedures are elective without a true specific medically necessary indication. And that has to be part of the discussion that you have with these patients. Working in aesthetics has been a big adjustment for me. Even 3 years in, I'm still learning to embrace this space and enjoy its unique benefits and challenges. I often tell my patients, it's not about your wrinkles. It's not about your volume loss. It's not about your imbalance or balance of your face. It's about how you feel when you look in the mirror. It's about confidence. So we're not eliminating wrinkles, even if that's what we're doing with the neuromodulator. We are improving brightness. We're lifting and we're helping you to feel better about yourself. I would say probably 95% of my patients identify as female. And I truly, deeply believe that we need more women who feel confident in the world. And that when you're confident, you show up differently in the rooms that you enter. So it's really my honor to be able to walk alongside these patients as we help to boost their confidence, whether that's with significant procedures or simply with educating them about how their face works and what the anatomy is doing and why certain things are happening, so that we can then decide if it's something that's worth treating or not. This aesthetic space is a crazy cool combination of medicine and art. It's my honor to be able to step into this space and cultivate relationships with my patients and help them to embrace their flaws and the things that make them unique and asymmetrical and perfectly uniquely them. And doing so in a way that when we do decide to do a procedure, they're informed and it's safe, and we're honoring their goals, and we're being respectful of their budget, and we're really helping them to get in touch with why these things bother them and if it's something that we want to correct or soften or lift or improve, and that they really understand the options and the treatments and the risks. I feel like I'm starting to ramble here at the end, so I'm going to wrap it up. But this aesthetic space is such a unique thing and so much different than what I expected to be doing as a part of medicine. If aesthetics is something that you're thinking about going into, please send me a message. I will link that episode with MARYELLEN in the show notes. Take a look, check that out. She talks about some of the things that she does. We sort of get into how Botox and fillers work, where we put them, why we place them certain places. And we talk a little bit about work-life balance and sort of what it feels like to try and do it all, or what it feels like to realize that doing it all is completely unreasonable and none of us are doing everything, and that we're all simply doing our best. Thank you, as always, for tuning in to another episode of The PA is In. I will see you next time. Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.